Okay, good evening. This is January the 14th, 2014. Happy New Year to everyone. We have not had a webinar since the new year, so I hope everyone enjoyed the holidays, and I hope you're getting out of the holiday funk and getting ready, getting back to work. Uh, Tonight, as always, we have one of our speakers that are scheduled to speak at our first annual Functional Medicine Conference, March 6th through the 9th. This entire webinar series is sponsored by AFMA, the American Functional Medicine Association, and we are happy to share this information with you tonight. And we want to encourage all of you who have not signed up for our conference to sign up as soon as possible. And in order to entice you, we have had our speakers. If you've gone to the website, you can go back and listen to some of the other speakers. But tonight, we have Dr. Richard Lord, one of our speakers, who I'm very excited that he accepted the invitation. Dr. Lord, I first heard him at a Metametrics conference where I heard him explain the organic acid test. And the organic acid test shows, among other things, how how the mitochondria makes ATP. And there's so many patients that you're going to see who complain of fatigue, and you need to understand how your body functions and makes ATP or energy. I'll be honest with you, I did not understand everything that he said, but I trusted him that he knew what he was talking about. And even now, when I do the organic acid test, I read the summary because the other information is beyond my comprehension. But clinically, I use that test almost every day. It's the basis of my IV therapy uh, treatment that I do. And it's one of my most favorite tests. Uh, Dr. Lord received his BS in chemistry from Georgia State University and his PhD in biochemistry from the University of Texas in 1970. Postdoctoral and staff fellowships were completed at the Clayton Foundation Biochemical Institute, the University of Arizona, and the National Institutes of Health, Institutes of Arthritis and Metabolic Diseases. He served as clinical laboratory director at Horizon Laboratories from 1974 to 1981. Then, for the next 8 years, Dr. Lord was professor and chairman in the Department of Chemistry for Life University, where he was instrumental in the initiation and design of a BS degree in nutritional science. Dr. Lord joined Metametrics in 1989 has been actively involved in the development of new testing methodologies and innovative laboratory report designs. In addition to co-authoring and editing the books Laboratory Evaluations in Molecular Medicine and Laboratory Evaluations for Integrative and Functional Medicine, Dr. Lord also publishes technical articles, lectures live and via teleconferencing, and consults with health professionals regarding clinical applications of testing for metabolites and toxicants. Dr. Lord has participated in think tanks on orthomolecular medicine, environmental medicine, and autism. He currently holds the position of Chief Science Officer for Genova Diagnostics. Dr. Lord, are you there?
I'm here.
Okay, great. I just want you to know, you can tell from that introduction, everyone who's on the webinar, that we only deal with the heavy hitters, and Dr. Lord is a heavy hitter. He is highly intelligent, as you can see, but he's able to lecture and help people to understand how to use the information clinically. So, Dr. Lord, can you just give us a little? I know you're planning on talking about something new in March, but if you can just give us a little taste of what you're planning on talking about, just to whet our appetite, so the people on the webinar will be anxious to come and hear you.
Okay. Well,
Hmm.
thanks very much for that kind introduction, first of all. I appreciate you saying those things, and I have enjoyed the trip of my career quite a bit all along the way. And I feel like I'm still sort of applying, even at 71, what I learned, in the early years. and have seen in practice in so many cases. So yeah, I'll be talking. It turns out I've turned my attention to a significant degree in the past several years from the small molecule weight, small molecule kind of biomarker, metabolic intoxicant area into the much larger molecules made by bacteria and the bacteria themselves and so forth. And so I'm going to be talking about this complex area of assessing the patient status of the GI tract, basically, by looking at stool, and that's the focus of it. There's lots of ways to assess GI function, of course, but specifically by just simply taking a stool specimen, which is the specimen that's typically used to investigate, the gut if you're not going to do invasive stuff. And so from that standpoint, you can get three basic kinds of information, and that is information regarding digestion, information regarding inflammation in the gut, and information regarding the microbiome. And those are sort of obvious things to everyone. The thing that we have to come to grips with is that those three areas are intimately related. They're tied together in this systems biology concept. And they're tied through the rest of the body, basically, because the signaling molecules that are generated in the gut are processed throughout the tissues in myriads of ways. So with that general concept, then we talk about the markers, the biomarkers that are currently being used to reveal the status of those three areas in a stool or fecal specimen. And so for digestion, we look at things like pancreatic elastase, for example. That's a pancreatic enzyme, and it's used as a marker. And you can, if it's low, that's indication of pancreatic insufficiency. When you move to the inflammatory state, the labs have sort of tossed around two very closely similar markers, and that is lactoferrin and calprotectin, two proteins made by the enterocytes and released when there's inflammatory damage. And so the levels go up as you get inflammation in the gut that's actually damaging the gut, and specifically the colon, because we're looking at stool specimens, which is primarily representing the terminal gut. So that's just a couple of examples of, we'll talk about other markers, but that's the kind of direction we'll go in those two areas: specific markers of digestion, specific markers of inflammation, and of course those two things guide your interventions with digestive aids, with support for gastric function and pancreatic function, so pancreatic replacement therapies, gastric acid replacement therapy, and just general support of the healing of the part of the gut that might be damaged in inflammation. So that carries over in that sense to the digestion has to be proper for the gut to maintain its massive role of immune surveillance. And so if that's getting out of bounds, then you have this inflammatory consequences that you can see. And again, I won't go through all the markers we'll be talking about, but then I'll jump in through the final of these three areas that I've outlined, and that is the microbiome. And that's the one that is exploding currently. That is the science and medical insights about the importance of the microbiome, the ways in which it's connected mechanistically, how it relates to what's going on in the immune system, and how it relates to digestion, how it relates to general, actually, central energy metabolism. That whole field is just burgeoning and exploding with information. So we're trying to keep up with that, as we always are from the scientific standpoint of trying to help guide doctors about what's happening out there. And specifically just on the microbiome aspect itself, about 10 years ago now, I guess it was, approaching 10 years at least, the old Metametrics lab introduced this new era of molecular probe testing for DNA. And so we're looking at the bacteria by measuring the amount of their DNA that's present in the fecal specimen. And that's the area that's really exploded, because mainly you can see the anaerobes, which constitute almost everything, 95 to 99% usually, of the bacteria that are present in feces. And so the old methods where you had to grow them in the presence of air, would reveal certain ones that could grow that way and very nicely, but most of the rest of them you couldn't see. And that area is the one that's really taking off in terms of the amount of information, the number of organisms present, what are the major players. But just based on what was done initially at the Metametrics introduction, we've had some fascinating insights. One of them I just published on in the past few months, the American Journal of Case Reports. We have an article on using that profile and detecting in a patient who had very unusual aspects in other metabolic areas, a very high fusobacteria count. And it turned out that the metabolic testing, which I won't go into, suggested that what was the basic problem, this is a functional medicine sort of way of thinking now, the underlying problem or the antecedent event that might have triggered a lifelong history by the way of headaches and maldigestion and skin problems and other things, was in fact a genetic disturbance in the linking of bile acids and the final formation of bile acids where you tie on to the amino acids, taurine and glycine. And based on that, the intervention was simply use bile acid therapy. And what happened in the microbiome now, just to I'll finish up with this little insight, is that the Fusobacterium dominance of the pattern, which is very unusual because although that organism is in the oral cavity commonly, it does not do well in the intestinal tract, and particularly in the colon. It's normally a very minor player. And so there it was dominating, and that was normalized after starting the bile acid. So we learned a good many lessons from that little investigation alone. We'd have a one-year follow-up of the case. It showed all the changes being sustained, and her symptoms amazingly started to clear up. The headaches had been lifelong virtually. She couldn't remember when she didn't have them, almost debilitating headaches, and a few conditions also, but those alone, within a matter of 3 weeks of the bile acid therapy, started clearing up like they never had. So we apparently, the intervention allowed her to, of course, digest and absorb her fat-soluble nutrients better, and introduced a factor that's supposed to always be present in the bile acids that modulate the bacteria that are in the colon. So it gave us a nice integrated picture.
So, Dr. Lloyd, I'll tell you, I went to your Metametrics seminar about organics and the GIFX test, and it totally changed my practice. As an OBGYN, I started out focused on hormones and estrogen and progesterone, and I thought that was it. And then I talked about cortisol and stress. But when I understood the GI tract and nutrients, because if the GI tract is inflamed, your organic acid test is going to look awful, and it's not going to get better until you fix the gut. When I learned when I went to that seminar, totally changed the way, and now I really feel like I practice functional medicine because the gut has such an influence on nutrients, but it also on the immune system and so many other things and skin problems. I do those two tests almost religiously on anybody who has any type of complicated functional medicine problem. And again, Dr. Lloyd, you can see he's brilliant, but when you break it down in the way he presents the test information, it's very easy to use clinically. So I promised in forming this Functional Medicine Association, I wanted to bring to you the people who taught me. Now, as far as I know, you guys aren't doing those seminars anymore, are you?
No, we haven't started those up again since the merger happened. There's been so
Right.
many other things to take care of. We're
Yeah.
not doing those currently.
Well, I
I
understand.
enjoyed them a great deal.
Yeah, so they were great. So, what I'm trying to do, Dr. Lloyd, is plug our meeting in March. You can't get it anywhere else. We have an exclusive relationship with Dr. Lloyd for the time being, that he's presenting it here. So, this is something you can't get anywhere else. And believe me, if you understand that organic acid test and that GI test, it will make all the difference in the world in how you're presently practicing, where you're practicing functional medicine, or if you're just a practicing physician. And I don't care what type of physician you are, from a podiatrist to a neurosurgeon, from head to toe, the gut is involved in a lot of problems. I'm really, if you've got uh, problems in your foot with joint problems or joint aching, it could be because you have GI problems and it's causing immune complexes to settle in the joint. So I don't care what kind of medicine you're practicing right now, understanding the gut, and I know all of you have patients coming in complaining of fatigue. Understanding that organic acid test will answer a lot of questions for you. So I just want to really emphasize the importance of coming and hearing Dr. Lord talk about the science behind it, and allow that science to be interpreted to help you clinically. Because, I say I don't understand half of what Dr. Lord understands, but I know he understands it, and he's going to give me good information. And that's what I think a lot of people get paralyzed. Oh, this is so complicated. No, you
Mm.
just need to know how to use it clinically. And
Yeah.
I just trust that Dr. Lord has done all these things and he knows what he's talking about. And then when you implement it clinically, you'll see the results. So, Dr. Lord, you were about to say something?
Well, you've triggered my thinking on two counts.
Hmm.
One is regarding hormone use. I've considered this for a long time, and it's an interesting kind of description you have about how your path, starting with hormones, and I think a lot of people do that for the simple reason that they're so powerful and effective.
Right.
If you have a woman with low estrogen, a man with low testosterone, and so
Hmm.
forth, you can really get some quick changes there. But as you
Right.
said, the thing you then, if you keep probing, you come to realize is that the hormones are basically there to sort of allow a compensatory response to underlying issues. And when
Right.
you change them, you have using powerful guns, but if you haven't fixed the underlying issues, then there's some work left to do, is one way to look at it.
Yeah.
And so the underlying issue, as you said, is the gut. And in that area, one of the things I kind of left out too that I'll have some time to discuss a little bit at the seminar is the organic acid test. You mentioned a couple of times.
Hmm.
It's a bridge or connected to the stool test
Yeah.
because the urinary markers of bacteria and yeast that are present let you see a special region of the gut. I've started to use the term neighborhoods of the gut. So you have this
Hmm.
neighborhood where these kind of bacteria live, and another neighborhood where other kinds live, and that's of course segregated anatomically. So with
Right.
the organic acids, urinary metabolic products, you're seeing probably no one knows exactly, but probably the region where the growth is most dynamic, which is like the terminal ileum and the cecum in that region. And then with the stool, of course, you're seeing the end of the line in the lower colon.
Hmm.
And so you can integrate those two to get an idea about just where the dysbiosis is the worst.
See, I know on the bottom of the organic acid test, it has those different chemicals that, the markers or whatever. But see, now I just learned it's telling me about a different area of the gut, because sometimes I will have given probiotic therapy and the stool test would have gotten better, but it still shows that I might need probiotics based on the urine test. So it's telling me that a different
Right.
part of the gut may need some more work.
Yeah, there's a lot of confusion after we started doing both of those profiles. People say, "Well,
Right.
this one is normal and the other one's abnormal."
Right.
They don't agree that the lab must have made an error, and,
Yeah.
and the lab can make errors, of course. But
Mhm.
in those cases, it's a matter of you have an imbalance in one region that's simply not reflected in the other. An insight there, by the way, that helps me a lot. Keep in mind is to a bacterium, the distance between, let's say, just the ileocecal valve and the rectum is
Mhm.
like a light year
Right.
to us,
Right.
you know. It's a,
Yeah.
well, maybe not quite that far, but it's a
Mhm.
long, long way. It's generations of bacteria, many generations. And so that's why, as they divide and compete on the way on down,
Mhm.
what emerges doesn't reflect really what's going on in the small intestine very well at all.
Okay. So the organic acid test is telling me more proximal areas of the gut, where the stool test is telling me about more distal areas.
That's right,
Ah,
exactly. And there's
okay.
overlap, of course. Some that in
Mhm.
that region, of course, of the ascending colon, you
Right.
have, you can see organic acid, and that will also sometimes usually manifest in the stools. But that's the way to think about it. You have these
Okay.
neighborhoods of the gut, and sometimes you need to treat the upper neighborhood and sometimes the lower one.
Right. Okay. All right. So if that doesn't spark your attention, believe me, you gotta come and hear this, and you've got to understand it. And again, if you look at it, we say we make functional medicine practices functional. I don't think you can practice functional medicine without understanding these tests because they will solve a lot of problems for you. If you fix the gut and you fix their nutritional status, you'll be amazed. And like you're saying, they need less hormones if you fix the gut. You're going to be able to manage hormone therapy better because the gut is so involved in eliminating hormones. Uh, um, uh, Beta glucuronidase, all of these, you have to have good bacteria in the gut in order for you to properly excrete hormones. Your liver needs to be able to work so that you can metabolize it. So you've got to know these. You've got to know all of this. And again, you don't have to know everything before you start, but you need to gradually move into this. So, Dr. Lloyd, I'm fascinated talking to you, but I don't want to keep you too long. So I appreciate you coming. I'll let you get back to dinner or whatever you were doing, but I'm so happy that you decided to come and be a part of our conference in March, and we look forward to working with you in the future.
Well, I'm extremely excited about being at your inaugural conference too. I think you've got
Yeah.
a great new philosophy for the
Yeah.
whole area of medicine, not just functional medicine. And I
Yeah.
congratulate you on your work there, and I look forward to working with you.
Well, great. Thanks again, and we'll look forward to seeing you in March. I appreciate it.